Hi, so what I'm going to do is doing an ABG. So I already knocked the first is knock on the patient's door, and then wash your hands and introduce yourself. And also after introducing yourself, I'm gonna explain to the patient what's the purpose of the ABG, and also observe the patient and reassess them by taking up vital signs. And once you're ready to go, we have to prepare the necessary equipments. So I have here the ABG kit, such as the needle, the cap, the stopper, the gauze, and band-aid, and also the alcohol prep pad. So now that I already explained some important things to the patient, I'm going to let the patient do a modified Allen's test by letting the hand of the patient uh, open and close their fist while I'm doing or occluding both the radial and ulnar artery. So now that I am going to let the patient do a modified Allen's test, once they're done, I'm going to remove the ulnar artery and notice the color of the wrist of the patient. And if you notice the modified Allen's test to be negative, we can use it on the other arm. And then because the modified Allen's test is positive, we will proceed in extracting blood. So now this is the patient. I'm going to let the patient be relaxed, extend their arm, and then there should be something underneath it, such as a tissue towel or paper towel underneath to let hyperextend the arm or wrist. And then before that, I have here a alcohol prep pad. I'm going to clean it in a circular motion, and then once you're done, dispose it directly. And then I'm going to prepare also the gauze, the band-aid, and even the safety cap, and I have here the needle. So now that I'm ready to extract blood, I'm going to position myself by palpating the pulse. So if you notice there's a pulse, we position the angle by holding the needle with like a pencil, and it should be like a 45-degree angle, and the bevel should be up like this. Then once you're able to insert the needle and able to feel the pulse, insert directly the needle to where the pulse you were able to locate at, like that, and then you will notice some blood going inside the tube. So once you're able to fill the whole tube with blood, put it gauze. Make sure you're able to apply pressure and then carefully remove it, the needle. Apply pressure for about 5 minutes, or if the patient is having blood thinner, should be more than 10 minutes. And then if applicable, you should be able to have extra gauze to also extract a little bit blood, such as if there are air present or tiny clots. And then because it is we're able to extract blood, we have to put it directly with a stopper, push it directly, and then remove together with the needle in a sharp container. So assuming that we're able to throw it directly, for example, so we have to put it with a cover, safety cover, and then put it in a safety bag like this. And then once you're able to apply pressure already for more than 5 minutes, we have to put band-aid, let it in the patient's wrist for about couple of hours, apply pressure. And then if you're not able to send it directly with this specimen, we have to put it on ice. And then we have here another important information, such as putting up patient's name, temperature, the ventilation. For example, if the patient is room air, we have to put it 21%, and what device. If in room air, just indicate room air. If in nasal cannula, put it on nasal cannula. And also we can also put our initials, and also if possible the name of the physician. And then we have to put it in here, and then send it directly to the lab. So that once we're done, we have to dispose everything, especially our PPE, gloves, our mask, our goggles, and then we have to wash our hands, reassess again the patient, and then observe the patient, everything what you're able to assess, and then document everything outside, and I think that's all.